September 12th at 7:05 p.m. Call the Board of Health meeting to order. And I did not see the minutes, so let me take a minute to read through them. Anybody else have comments along the way?
No, it looked good to me.
I'm still fighting with me.
Oh, no.
Not in this week. Oh, we're by, okay.
Try again, Judy. It's just that I don't have your password
I know.
information, so it's kind, or not password, I have
Alright,
the information, so.
do I hear a motion for the minutes to be approved
Sure.
Sure.
as written? So Lori and Judy seconds. All in favor?
Aye.
Thank you.
Can't find my pen.
I had the same problem.
I might have.
Got one. Ta-da, I got it.
See, keep doing that, Nancy, and they show up, the pens show up. Okay, there's that one. Next is the COVID-19 flu Maven update. Anything, Judy, in regards to Maven?
No, mostly, I mean, the cases are up.
COVID,
Of COVID,
yes.
right? Across the state, there's about 16% hospitalization rate. That doesn't seem really out of balance when you start thinking about the number of cases that also land in the hospital for flu season.
Mm-hmm.
So it's above what you'd expect for a flu season hospital rate, but it's not exorbitant. So it's still a
And
matter
I'm sure
of
some of it's probably incidental, like they're there for something else and they're testing
testing.
and finding it, but it may not be why they're in the hospital.
They think
So
they're
it's, they're in the
respiratory.
hospital with COVID, but
Yeah.
not like from COVID.
Everybody
Mhm.
automatically gets tested for COVID when they
Yes.
go in the hospital.
Yeah, so
Mhm.
it could be something like that too, is why the numbers are
Are up.
higher.
Mhm. But-
Mariah,
But their new vaccine should work very well.
the bivalent,
Yeah, they are,
There's
the
something with that,
reports
too.
that are coming in from South America where they're giving it out now.
With the flu
Yeah,
vaccine.
because their season is winter right now,
Right.
so it seems to be doing a very good job.
oh, the flu,
Laboratory
the
lab.
flu shot, yeah.
The COVID shot too.
So Raya said there's been 2 students since school started
Okay.
that have had COVID and have, been fine, just COVID tested for whatever reason, they were in
Mhm.
contact with somebody who had COVID. The other thing I just heard from the Community Health Connections, is that they were just told by CDC and, Mass DPH not to give any bivalent COVID shots. They're not allowed. They have to cancel COVID clinics right now, and they cannot give them. And I said, why? I said, it's because you guys get a bad batch, or is this statewide? I don't know, the nurse just said we have to cancel our thing, we cannot give any bivalent COVID shots.
And they're not even.
So I'm gonna look into that a little bit more
Yeah.
and find out.
I'm wondering if it's because
What?
there's the new vaccine coming out within 2 weeks.
That's what's,
Yeah,
yeah, 'cause
but
it's
in
supposed
2
to
weeks'
come out
time,
in 2
that's-
weeks' time.
Yeah, and then it'd be a month, 4 weeks before they're actually covered. I would think they'd want people covered in the meantime, even if there is something new coming out.
Well,
They don't usually
there's
pause it for
2
that.
versions of COVID running around right now.
Yes, there is.
Yeah. So I'm not sure why they were just told to
Okay.
halt that.
All right, for that group.
But they are planning on having,
I don't know if it's statewide, everybody. I'm not sure, and I have to look
Or is
into
it
it.
local?
He just told me
Gotcha.
when he got home from work, and I went, ugh,
Gotcha.
why? So they're canceling all their vaccine clinics, the Community Health Connections.
there is going to be a flu vaccine clinic October 4th
Where's that one?
in,
what kind
at
of clinic?
Waterford Street School in Gardner.
Oh, in Gardner.
And they're having a health fair.
Do you know if that was sponsored by CHC? It
I
usually
think
is.
I think they usually contact CHC.
So it'll probably
They
only,
did last year for
Fourth?
this,
Fourth.
Yeah,
for
Lisa
the
Ellis
health
usually-
fair, yeah.
so it'll probably only be flu and not COVID.
Probably that, if they
Because
stick
if
with
it's
what,
CHC and they can't
yeah.
get the COVID ones, it'll be
They
flu.
don't get the
But that's
brand.
fine, everyone should get their flu shot.
Judy,
They're
you
also
said the
gonna
fourth.
they're also gonna, offer shingles vaccines as well,
Oh,
The
wow.
4th, you said?
the 4th. From 10 to, 10 to 3, I think it is.
During the day, is it a weekend?
During the day.
It's a
They-
weekend?
They held it no, it's on a Wednesday.
Is that the school?
No, it's
Waterford
Waterford
Street's
Street
empty.
School is
Oh.
empty.
It's empty. They all went to the new
They're
elementary school.
converting that to town hall offices and a senior center and other communities,
Gotcha.
Okay.
so.
Did you reach out and
Yes.
hear
Yep.
from?
So I heard back from Victoria, and that day is still fine, Thursday, November 2nd, so that's when we'll have it. It'll be 5 to 7:30 in the gym. I've already booked the gymnasium, they said, oh yeah, we don't have anything in there. So there's no basketball, there's nothing. So Janice booked us in there, so we're all set with that. And she sent me an email, cause I'd asked her, you wanted to know if there was any charge to the town. And it says, the clinic will be provided at no charge to the town since Hubbardston is a member community of the MPHM. So she verified, you can have this if you want, or if you don't care,
Yeah, we want it.
saying there's no charge. And then she said, I'll be in touch with you approximately 1 month prior to the clinic date, with the flyers
Okay,
to
That's
be
what, November
sent out.
2nd?
great.
Hmm?
That's November 2nd.
November 2nd, it's a Thursday evening.
Yes, I know, I'm on the, I can't, because I have a meeting.
Yeah,
Okay.
it's a Thursday evening, so,
Yeah, and you can keep that with
she's on vacation right now, cause I tried to contact her again today, I just wanted to verify that they were doing both adult and pediatric
Gotcha.
shots, and she's on vacation, so
Okay.
I couldn't get an answer from her today, but I will.
I think that's great that we
Um,
have our own clinic.
And I just wanted to let you know, last week, I came over to the Board of Health office, and nobody was there. I think Nancy, they said you were having an issue with your doggy.
My dog, yeah, he's okay at the moment, but he's.
Oh, they thought you were put down.
Yeah, but he, no.
Okay, all right.
We will be.
But anyway, so I did go over there and I took 10 of the COVID tests over to the senior center and a thing of masks, because it is picking up, and
Yeah,
they
I
said
put
they were
more in the
completely out
library.
again.
Yeah, I put more in the library just the other day when I returned some books.
Nate
Um,
grabbed
does-
some for today and brought them over here.
Yeah. Does the
Yeah, 'cause they
school
were
need
completely
any?
out. I did not ask Raya.
Okay.
She was
Cause
having
if they
a,
want stuff, if this elementary school needs them, we can certainly supply.
all right, I'll ask her, if she needs any more.
Okay,
And I also, when I was over there, I ran into, is it Sue?
maybe.
Somebody that writes the newsletter for
Oh,
the senior
Sue,
center.
yes.
Sue.
Sue Brady,
And
yes.
so I wrote up something for her to put into their newsletter,
Oh,
with the
yes,
date and everything of the vaccine clinic.
wonderful.
So that's been done, and she was gonna put it into this month's newsletter.
Yeah, cause it's the right time to do it.
Yeah, yep,
That's
so I
great.
figured I'd get that done while I was over there.
Excellent, thank
Um,
you.
And the last item is that there's, on the, news, there's been a lot of talk about, Triple E and West Nile virus.
Yeah,
There's only been 3 cases in the state of West Nile, and 2 of them were in-state, one was, and the third one was they picked it up out of
Mhm.
state. And Triple E, they only have like a couple cases. They're a little surprised at that, because, especially with West Nile, because the viral load in the mosquitoes is a little on the high side. So they said another month, and then when the colder weather starts coming in, but they've been advising that, go around, especially with all this rain,
Mhm.
Washed them all away, hopefully.
I would have
No,
thought,
just the
or drowned them.
Drowned them, let's
There-
hope.
There's
I
plenty,
did forward something
right,
to everybody about that.
You would have thought that just the weight of the rain hitting the mosquito, that's it, you're done.
Yeah, really, and all the little larvae in the water pools and puddles and stuff washed away,
Mm, yeah.
hopefully. I had one last question. When we put the vaccine clinic information onto the town website, who do I contact to ask?
So
You can give it to me and I'll
you
give it to,
me,
I'll give it to
Nancy,
Candace.
and then
she'll
Candace
post it.
puts it on.
Okay.
So give it to
Alright.
Nancy and she'll,
So should that be done like now, or should we wait till it gets closer?
I
What do
think
we
a
do?
little bit closer, maybe after the end of this month.
Okay, alright,
Just not last minute, but maybe towards the end of the month.
okay.
Once you
Alright.
confirm that we can do pediatric, that's why I would wait.
Okay,
That's the only reason. So that we can put that in the message.
And they can probably put it right on the front,
Yes,
front page, homepage,
they can put it on the homepage for that, yeah.
as an upcoming event thing.
And at some point, we can ask Nate if we wanna do a e-blast out to the town
Mm-hmm.
also.
yeah, like a one-call type thing.
How do we get on that sign down there?
The
Oh,
electronic
yeah.
signs, it should be on both of those, the rec field and the one at gazebo.
The
We
rec
have two
field?
One
now.
at the rec field?
No, that
Well, that
was
one
the-
on the side of the road, they got rid of it?
I think
Is it gone?
No,
It's,
it's there.
It's
It
in the
is?
parking lot, right before the
Ah.
pallet place,
Yeah.
right?
Oh,
I think
on
it's
the
still
sign,
there.
kind of.
the sign is
yeah.
still there? Okay.
Yeah.
I don't know if we can still use it, but in any case.
I think to check with the police,
Yeah, they,
cause
we,
they've been
So
put.
check, again, give the information to Nancy and she'll make sure it gets up.
yeah. And I think, Katie does the other side.
Oh, okay, but we can work through that.
Yeah.
So just make sure, you know, those kinds of things you get to Nancy and then we'll
Okay.
make sure they get out there. Okay?
And by the way, there is a Board of Health webinar every other week. I sat in on it today, it's pretty boring, but it's from 3 to 4, it's on, what's today, Tuesday?
Tuesday.
Tuesday, every other Tuesday, so in 2 weeks' time, it'll be, and all you have to do is, anybody that's on a Board of Health, just sign in when you're registered as a Board of Health member and fine.
Where do you get the link?
I'll tell you what, I'll
Usually
send it
off
on,
the
I'll send the
email, right?
announcement, because once
We
your
have a Board of
name
Health
gets
number.
into the system, you're in the system forever,
Okay.
so.
There's a Board of Health number you have to put in?
No,
Oh, oh.
no, just put your name and that you're a member of the Hubbardston Board of Health.
Okay, gotcha.
Tomorrow morning at 9:00 is MPHN meeting on Zoom. Do you wanna listen in on that?
I'm gonna be at the
You're tied up?
school.
Okay.
Yeah, Wednesday is my day to be in helping Raya.
Okay. Just wondering. I'll listen in. Okay. Title V reports, perk tests, anything?
Since this came in, this actually came in, I didn't bring it. It came in on the 25th and it was a fail.
Oh,
Cause they had done a perk application. And then this came in the other day. And it's a soil suitability, I think they're redoing the whole thing.
so they have to submit new plans before they start
Mhm.
construction. And Lucas Roddy should know that.
Yeah.
Just shows that in July it failed, this is their now soil suitability test, that's the next step. And then you would, and then a new plan has to be drawn up.
Might be on that other.
Existing
Yes.
sewer is below the basement floor. Okay,
Huh?
existing building sewer is below the basement floor.
Since it all failed, it doesn't,
That's, a really weird place, so.
Yes, it is.
And it didn't sink at all.
I don't know.
Or crushed the house.
So, and just make sure that we get a new engineering plan before
Mhm.
they start.
Yep.
There's somewhere you need to make note of that, or remind Luke.
I'll put it in the call.
Yeah, it doesn't hurt,
Right.
cause we all get busy, and, to remind them that we need since it failed, we need a title, excuse me, a new
Engineering.
Yeah, I'm
an
trying to
engineering
figure that
plan
out.
in order to, before they
Little
do any
crushed.
repair / new construction of a new site.
This is below high ground. Any portion of this.
And then, of course, if it comes in, give it to Phil right away.
Mhm.
High ground
So they
water.
saying that they don't mean like the sewers below the basement floor, it must just be the tank for the sump pump thing. Right, so that it's going under the
This is
basement floor, but then
why.
being pumped
And
out.
when does the,
into the
does it
tank?
show where the piping is? It failed because it's above high groundwater. So it's not deep enough.
Mm-hmm.
Yeah, cause it says if they relocate the tank, then it avoids the need for the pump. But it must be the
Septic
pump
tank
that's under
is-
the basement floor?
Mm-hmm.
Yeah, I don't think they mean
Mm-hmm.
the actual
The one that-
sewer.
right now,
Often-
the tank is outside the house,
Correct.
12 feet from the house.
Right.
Yeah, so it must be the pumps under the basement cement
Because of the
that pumps
size
it
of
up to the.
everything.
And,
Yeah.
and
I'm sure it has a
where it
lot.
goes from there, they have a question mark.
So, yep, so we're gonna need,
Okay.
yeah, that's definitely why, I'm sure he's aware,
I'm
but.
sure
Right,
when, I'm
right.
sure when they have to repair mine, they'll have to take all the trees out.
Well overgrown.
Alright,
Oh, the trees have been drinking
water tests that I can
nitrogen for
look
a
at.
long time now.
I'll just summarize them,
They're very healthy.
outside summaries, like I did last time.
Yep.
So it does not even say how the distance
I
is between
highlighted
the well and the.
inside.
Is that
There's nothing
because it
from-
failed and he knew he'd be back to do a more detailed map? Because that's really nothing.
Yeah, I
Yeah.
don't know. Yeah.
Just saying the system
Fails.
is above high.
Fails.
High water.
A lot of discussion for
Throwing pens around.
These are our last water tests, right?
So there was a water test done on Comet Pond on 8/22, and it was, the E. coli was only 3 MPN, whereas, Beeman's Pond is like 378. So we're doing good, very good. And then Comet Pond on the 30th was 4. Excellent numbers there, just giving a quick summary rather than the whole thing.
That's fine.
That's not that one to worry about. Okay. So yes, Comet Pond remains very, very clean.
Yeah. You don't see too many geese around there, which is good.
Yes.
Because that's what the problem usually is, butch
Okay.
geese.
That's for Cushman that passed.
Yes. Again, at Cushman Pond, which is, they were 3. They were 3 also at Pinecrest. Perfect. Can't ask for anything better than that at this point in time, considering many locations are way, way higher.
This is just a well completion report.
55 Williamsville Road hasn't obtained a well permit, because that's all they were doing, and they put it in.
And it says, I called him on that because it says draft on there, he says it's just an error, it's not, it's the original.
Okay.
I guess somehow they're having a problem with the word draft coming across the sheet for all of them.
Right. I don't know if you wanna look at it or not, it's for a farm.
Let's see how deep it is, just curious.
I don't know, on the draft, look on the draft, well,
Yeah, that
the
first.
official
It-
report.
I think it does say on
It's, I didn't look close enough. I should have, was curious to see how, it is a
there. Do
curiosity.
you wanna send off, I mean, just that you reviewed that?
Oh, yes.
And then just
Thank
that you
you.
reviewed that.
So. No. 200 feet.
Oh, not bad,
Yeah, that's not
cause
bad.
my well's much deeper than that, and
Mm.
only a few
Mine
doors
too.
up from them.
Mine's a lot deeper than that. The test numbers are good. Okay.
Next item after that is results from Hubbardston Housing.
Do they do the testing themselves, or is that the state doing the testing, or?
It is provided by a company. Here, pass it around.
They don't, is this a requirement for them to
Yeah.
do this?
Yes,
Yes?
Partly because it's an elderly complex, partly because there's over 25 residents.
okay, here we go.
Remember, they wanted to get it done quick, so you
mhm.
came in and just so that they could look at it.
And I need to see which part here, this part, yeah.
I love this stamp.
Yes,
Do you know where it is?
you haven't found it?
No, I use it.
Oh, no, where is that?
It's,
Why is this like May 2nd, May 26th, and then 6/29?
Because they did it 3 separate
go
times.
from.
Because they just have to do it 3 times a year, is that what it is, or? It's just weird dates.
We don't
So
find
So
out if
5/26 and
6/29.
How long is that then?
6/29, so it's like,
there may be
2 months
Are they
apart.
three big,
I know
there's
Mallory
different
used it
buildings.
at some point, did you see it on?
oh,
Yeah.
is that what it is?
I just love it.
It might be
because it
different
just
buildings.
shows, you know, remembered something. Date and time and all of that.
I haven't received any notices lately about putting or upgrading new water systems.
Oh, it says
So-
3 Old Princeton Road cutoff, 3 Old Princeton Road cutoff.
That's their,
That's their official address.
that's their email, that's.
So,
Is there
our
one-
question was, why 3 on 3 separate days? Like, is it, they're testing 3 separate sites? Are they testing?
Well, there's 2 buildings. I do. That's a good question, so why they're doing, unless they just put in a new filtration.
I think the last time we done that was.
Yes, I
Sure.
They do seem to repeat them back to back. That, we've gotten that many times in
Mhm.
meetings
Yeah.
from them. But that is a very good question.
Yeah.
You can have, they only have.
Maybe
board
they
meetings
have
a year.
to-
Once a year.
Maybe they
Once a
have to
year.
do it 3 times in a row to make sure they're
Yeah,
getting
that, I'm
consistent
wondering the same
results or
thing.
something?
Yeah. Yeah.
I could drop an email and find out.
That'd be great.
It could be, maybe they changed the filters on it.
And then just to see how it is.
It is a filtered system.
Well, if they tell us what they did, they checked the splash recycle, all components are operational, effluent is compliant on May 2nd.
Let's say the same thing on all of them.
It's a little bit different.
So if any of these
26.
results were off, would it be indicated somehow?
Uh-huh.
It would, so because they just looked like this was, assuming they were all within the limits.
Right.
They also cleaned the filter on the
Ah,
26th.
There you go.
So
There's the
I'm-
answer, right there.
So they cleaned the filter on the 29th here too. Actually, that's exactly the same. These two are the same.
Okay.
The two
But
second
with different
ones.
dates.
So maybe they
Yeah.
take whatever
May 26th.
the
System is,
system is first, and
supposed
then
to.
they change the filter, and then they change it again.
check it again.
Maybe.
Yeah, yeah.
Yep. Well, they're
Like maybe
being,
they identified it needed to be changed, came back, changed it.
correct.
Wastewater treatment, wastewater
Yeah,
treatment
it is a big system,
system.
Mm-hmm.
but I can drop a line to the manager and find out. Maybe she might be able to shed some light on it. If not, we can get in touch with our CAP and find out what, maybe they'll offer an explanation, I'm sure. They have several senior housing homes that they watch over.
There was a repair, septic repair, and, Phil Ledger had reviewed everything, but they really wanted to get going, to get it done so that the family wouldn't be without the septic system. So I did come in and sign it, but here it is to review. I did look it over myself closely before I signed it. But you
Oh,
guys
they
can-
even provided
there's
3
3.
copies.
Mhm.
Isn't that
so,
nice?
I did, check it over, but just to make sure that you guys have also checked it over.
This is a big house,
Mm-hmm.
5 bedrooms.
I think it's between 4.
Yeah, it's a group home.
You should have a list of all of the homes. If something goes awry,
Isn't that like a HIPAA thing though?
we just need to know if it's a group home.
Not who's there, yeah.
Right, we don't
Oh,
need to-
yeah, right.
Yeah, we don't need to know names,
No.
just addresses, locations. That'll be a
Because
good
if there's
idea.
if there's any kind of disaster or event or need evacuated,
That's
we need to know.
Mm-hmm.
What does the Board of Health and has emergency management, fire, police.
Mm-hmm.
Okay, there's all of that.
That's a big system too.
Mm-hmm. So they needed to get started on it as soon as they could, and so.
They're just repairing what's already existing, they're not moving anything.
Oh, Williamsville Road. Way down and we don't live far down on Williamsville. Down by Furniture.
That's another one, yes, that's the second one. And I'll just, okay, everyone okay with what you see? All right.
Looks good.
Next is, there's no permits, open septic plan, engineering reviews. That's
Nope,
this
that's
one.
that. So the next is the nursing position.
Do we have any more? Yeah, go ahead on
So this was just the emails, you would want it to table this until today's date, unless you wanna wait.
I don't remember too much at this point. Oh yeah, they wanted to put it before. I think we probably just kinda need to go over it. They wanted some sort of, presentation, formal presentation. So,
I would like to suggest that if you have that, re-email it to all of us to review
Sure.
yeah,
before the next
Yep.
meeting,
Okay.
since we tabled it for a while, and I know I haven't looked at it recently.
right.
So that's the new job description?
That was the suggested job description form to use. And when we first looked at it, the area of, was it responsibilities?
Yeah, there was something that you.
In the area of responsibilities that we were like, maybe we should think about this. So look at that, and, so we can bring those ideas forward at the next meeting and then get moving on it.
Yeah, they wanted something formal, all lined up and to present to the Board of Selectmen.
Right.
I know.
I'm getting fancy.
No, so we'll do,
I'll send it back
send
out.
it back out, we'll look at that particular section, I mean, obviously read the whole thing, that was what the area that we thought needed to be reworked originally,
The responsibilities.
yeah. That's what I remember anyways.
Overkill.
Yeah, well, that was stone, right? Is that
Yeah.
or-
Yeah,
Little
And
bigger.
second, if you can, could
Coming
you send
from-
another email to that
shrink it down.
interested person?
Yes,
Would you give her an update
Yep.
that we're re-reviewing it so that we can go forward?
I think her name was Daniel.
Yeah, I believe so. Okay, any new business, unexpected subjects?
I have one.
Okay,
So, when I went into the Board of Health office last, I don't know, was it Thursday? I also had kind of a second thing on my mind. The school is looking for possibly a copy of any emergency evacuation plan that might have been on file with somebody in the town for them. She's a brand new principal.
oh, okay.
They could not find anything. Last Wednesday when I was there, they actually had a fire drill. And I guess there were a couple of issues with where the children were supposed to go and wait. Fire department said their existing plan, they were a little too close to the building still.
Mhm.
And they wanted them to move further. And then, I talked to her, Erin Cook is the new principal, about, an evacuation site. And that we had remember we talked about this a while ago,
Mhm.
we thought maybe it was is it the Unitarian Church? It's across 68 from the school. And that used to be their evacuation site, somebody said the basement or something there was where the kids used to go to.
I don't know.
I don't think they've ever gone.
No, I don't
Does
know if
it-
they've ever used it,
No.
but that was the plan.
It's
Yes.
okay that it's
Yeah.
across a street without a crosswalk?
I think that was an issue.
I've never seen
In
an
emergency, I
evacuation
don't think
plan
the crosswalk
here.
is gonna
They're-
matter.
they're just gonna go.
What little
If
I
it's an
know
emergency,
about
the
it
place is on
is
fire,
that
if there's something going
the
on, I
school
don't think they're gonna wait
committee
for a crosswalk.
on
Somebody will just stand in the
superintendent's
middle of the road
office,
and make
yeah,
sure
for
no
the
one
school
hits them, right?
system.
I mean, there's enough staff and
You would
teachers.
hope.
was
Yeah.
supposed to work
Yeah,
with
I
the
don't,
school.
that's,
Okay.
they need to get away from the building,
But
Coop
is
didn't
the
have
issue.
one?
And if
The
it's
old Coop didn't have
building
anything, right?
is on fire,
We
and
need them to
they
done a
can't
coop
stand
for them,
outside if it's
but
10
that's
degrees out,
probably
they
a
have
good
no coats.
idea.
They're
Right.
little kids, there's kids in
Um,
wheelchairs.
I have a
They
template
need a place
that
to
I'll
go,
take a look at it,
right?
it just, I
To
just
stay
got in
safe
my
and sheltered and all
mailbox.
those things, it could be
So I'll
a
take a
lightning
look
storm,
at
when
it,
lightning
see
hits
if
the
it's
building,
adaptable.
what are they gonna do,
Okay.
stand out in the field in the
Um,
lightning,
Um,
in the rain?
No, I understand.
Because I was.
There
So
has to be
Lori,
a-
Because
Lori,
when the town-
we've got two conversations going on here, and I understand your concerns about not having a plan and not having a place to go. Judy to Scott, you said an email,
Yeah, I just got a template, it's a very simple template for like a COOP plan, that could
COOP
be
is the
used.
town emergency plan.
Yeah, the one that the town is looking at right now is a lot more in-depth. That's one that Nate has that we need, because of Dennis's death, it got sort of
Pushed aside
pushed
for a while.
aside. So we'll pick that up this fall.
She's the,
But the
But-
COOP template may be a good.
Maybe it's simple enough that we wouldn't,
She could use it,
yeah,
So there isn't currently a plan.
to the best of our knowledge.
there's never been one
Not
to
mine.
my knowledge.
somebody said they thought that that was the plan way back and that that
Yes.
building was where the kids were
Well, it
supposed to go.
never got written down, and it may have come from the superintendent's office,
As a
but it didn't come from the
recommendation.
town itself.
Yeah, cause I mean, clearly whoever owns that building is privately owned, right? Would have to be.
That building over there is ours, it's town property.
It is?
Yes.
Oh, then that's a good site.
Somebody told me it was privately owned church. It's
It is
not-
a
Oh, the
church.
church, yeah,
Go ahead.
yeah, that town common is town property, and the church sits on the property, but the church,
So for us
it's
to
a weird
use it.
situation.
Yes, it's
So
a,
for us to use it, we would have to have their permission, is what I'm saying. Somebody,
Correct.
whoever
Correct.
owns it would have to agree to it and leave a key to the place with the school,
Correct.
right? So if something were to happen and they needed to get the kids out of the school but safely sheltered somewhere, that,
Mhm.
so Erin is coming up with a plan too, because between the, you know, what happened with the fire drill,
Mhm.
and I guess the Quabbin Regional District too is doing this with all the schools in the
Mhm.
district.
Mhm.
She's working on it, she's coming up with something. She had just asked me if there was an existing one, like even if it was from 30 years ago, you know, could she look at it, you know, see what the plan used to be and like go from there.
Yeah.
But if there is no such thing that anybody knows of.
I'm not aware of one since I've been on the
No,
board.
and I've been involved in emergency management for, I don't know how many years, and
So
we've
if there
never
ever
seen
was
it,
one
we've
by
never-
some old principal, they might have thrown it away because it was so old.
It may have been done like a group that got together
By
from
the
the school
school,
district.
by the school itself. You'd think they would
Or
have
the
involved
school
the town.
district.
Somebody said maybe the fire department would have had like a copy of something like that,
No,
but no,
Not likely.
not likely.
not likely. Okay, so
So
they,
we should
she
all
will-
start from scratch
She
on
will
this,
be,
yeah.
she will be working on that. Do you think you could send me an email with that basic
Coop
group
thing?
thing? Yeah.
Yeah.
So
Might
that
help
way
her
we can-
formulate something easier.
Yeah, I'm sure Quabbin Regional is probably providing her with, you know, some type of guidelines if they're the ones, you know, kind of saying, hey, we need a plan for every single building. Every building I've ever worked in Gardner, they all have a plan and it's
Yeah,
all
it's
posted and it's
concerning.
well known and everyone know, you know. I just don't get it, that there's never been
Hey.
a plan. Like, the chance that you'd have to use it is so slim, but
Just the
if
same.
you did,
you need
there
it,
needs to
mhm.
be something in place, and it's like, it's crazy that
Well,
there
I
isn't
think
one.
there's been an attitude, because when we first moved here, it was a country school. You know, it was
Yeah.
just, yeah, it was a very much a country school.
But
So
could
it
still
just
get hit
never,
by
it
lightning.
never got taken off when the school expanded and grew. But when we first moved here, it was one building. And, you know,
Yeah.
it was a country day school, is what it was.
There's enough scenarios though where if
Oh,
they
yes,
need
Oh,
and
to
yeah.
yes, and
Yeah.
we're not
evacuate
disagreeing.
it, even if it was only 50 kids in the building, you still need a place to put 50 kids. You need a place to put hundreds of kids.
Yeah.
It's just, yeah, there needs
It's
to
a
be
little
something.
unusual that there's nothing.
That was my thought.
And they should have
Every
a-
school I've worked at, there's
And they
always a
really
plan.
should
So when
have
I
a
said to
good
Ryan,
plan
what's
in
the plan
place.
for evacuation here? She's like,
Because you,
I don't know.
there's medically fragile kids too, right?
Yes,
One of
there's
the
kids in
things-
wheelchairs, there's kids in there that are
Yeah,
like
it's
medically.
okay, yeah,
Yeah.
yeah.
And one of the things that we did do, the CERT team did, and I don't know if they're keeping up on it, I haven't checked up on it for 2 or 3 years, but the CERT team provided backpacks that they could take and grab. And one of the things that we recommended, the CERT team did, was that, and we set it up that way, was that they would have, color-coded bands. It would be a color for, a different color for each grade, and that with these colored bands, so these kids left or got out, you know, that they would be able to band them, but they would also, each year, that there would be on the sticker labels, would be the classroom, so the teacher could, you put the labels as the kids, you know, get the kids out, get them safe, they gather around, the teacher puts the band on them with their name and whatever information the school feels is appropriate, and that, so every kid is banded, but when they get outside, we provided all of that, plus we provided, flashlights, and I have the checklist at home.
I think I've seen those bags. I think they're spread around the school.
Right, they're each and every teacher is supposed to have it and upgrade it, but the CERT team is the one that provided all of that. And I have the checklist at home if that's something that they wanna check out too, because that's part of,
That's part of your exit plan.
Yeah,
The
so I'm
exit
surprised
plan.
at the time when they did that, they didn't come up with an evacuation location.
right.
I'm surprised they didn't follow it further.
But they should have a coop plan, and they should have evacuation
Yeah,
plan.
and that's what they're working on that this year.
Yeah,
I think
but
she
the-
just wanted a place to start, but if there isn't one, I'll just tell her, you know, she needs to come up with
Well, there
it.
is the CERT plan with the wristbands and everything, so that's in existence, so she can build with that.
Mhm.
Yeah, I think they more meant
And
like
they should
where,
have a coop plan,
because
cause they got
were
records
too
that
close
they
to the
need to
school.
move, if the school needs to evacuate for whatever reason, they need to move, they've got files and records and things like that, they gotta know where they're gonna move it all to, and where they're gonna set
Well, they're
things
not,
up.
no time to take that stuff. They can't even grab coats for the kids. There's nothing. They have to just get out.
Well, immediately, yeah, but,
Yeah.
you know,
Secondarily,
yeah, second.
Oh, if there's anything left.
After everything burns down.
Everything burns down. All right, so I'll just tell her that.
yeah,
thing
so
is up.
there's the CERT.
So if you
there
email me
is-
that coop plan thing, then I'll.
And then
Okay.
there's the CERT information in the classrooms.
Yeah.
That you know, each year
Yeah, I
needs
don't know
updating.
how long ago that was. If it was 10 years or more, that stuff may be lost. I don't know.
No,
Well,
it's
it's
not,
not.
because
Personally carry
it's
my
been
kids
on,
as a
since
tip.
I've been on the board, that you came to the
Is it
meeting
time
Mhm.
to
and
personally
provided
carry my
it.
kids on
Yeah.
tips?
It's before you got on the board, so it's,
I have 4 grandchildren.
Maybe
there
5
myself,
years
so
ago?
I have concession.
Better start working.
I'm
out,
guessing.
huh?
Yeah,
my
I know,
memory.
I think it was about 2 or 3 years ago that, well, just the year before COVID hit, Dennis and I were in there and we updated everything.
So like
It's not-
2018
Not
maybe?
18-19,
2019,
2019.
yeah, and we
For
put in
CERT.
fresh, first aid kits and everything else, but so, and then COVID hits,
Right.
so.
So 2019, the CERT part was updated.
So there's a bag for every classroom.
Mhm.
I know there are stuff, and they carry this stuff out, like at the fire drill, they carry
there's-
things out, and then they have the clipboards, you know, red, green, the one with the
Clipboards
red
is
cross
supposed
on
to
it.
be, yeah, there's
So-
clipboards in those bags, and then there was also a jump rope, so we'd be line the grab onto the jump rope on the way out. You gotta teach the kids, they should do that with their fire, grab the
The rope,
The
so
rope.
that each
Mhm.
class stays together.
I'm just more like about where are they going?
So,
Well, they were
um,
supposed to go down to the baseball field originally.
Is that what the?
That's that field way in the back there?
Fire said they don't want them there, it's too close. And plus, like I said, if it's 10 degrees out and they have no coats, and these are little pre-K kids,
Yeah.
you can't leave them out in the field for more than, 10, 15 minutes, and they're gonna get frostbite. So it's a matter of, you know, in the elements, right? The real cold, the rain, lightning, that kind of stuff, where do they go? They can't stand out in the field.
Well, they can always do what you and I did. Remember?
Duck and cover?
Oh.
In the hallway,
Yeah.
just in
'Cause that
case
was
the
gonna
bomb
save you.
came
Mhm.
down.
Yeah,
My
'cause that
kids
was gonna
actually
save
did.
you.
That was gonna save us
That was gonna save you.
Under your desk.
under your desk. So
And the
the
fact
building
that your
didn't
school's
fall
right
on ya.
next to Hanscom Field didn't really, you know. You're doomed anyway.
I did do one food inspection of the, Spice Company Anthony on Brigham Road, and he has a wonderful setup,
Great,
so
Good.
that's done.
good.
And I'll start catching up on some of the rest of this, because the rain is just destroying everything at the farm, basically, so.
Yeah, I'm wondering if that was why, when I just drove here, I don't know if I'm the only one that drives past the two marijuana facilities.
Oh my gosh, yes,
Really bad
Really?
just
Really?
now,
very potent right
really
now.
bad.
Oh,
Yeah.
okay.
And I'm surprised we haven't had any odor complaints.
Yeah.
And then I'm thinking, well, is it because it's been so rainy? Did they not get their harvest in again like last year and
Well-
it's sitting out composting just,
No, I don't think so,
And it smells like plants. It really did
It's
have a plant smell to
very
it, but
strong.
it's very,
very strong, like my
very
windows were
strong.
rolled up and I'm driving, all of a sudden,
Whoa.
whoa, my
Yeah, I
car
know,
was
it's like-
full
Okay.
of that
Yeah.
horrible skunk smell and it like,
Okay.
it just
so
goes on and on and on.
if you would fill out an odor complaint,
Oh, am I
please.
complaining?
Yes, you are. Yes, you are.
She needs yours to too then.
Yes, please, and
I
date
just
it,
noticed.
just
I know,
write
it's-
it,
we noticed, we
please.
didn't complain, we noticed.
No, I want you to fill it out so that we have a record of the
Day and time
frequency.
and that kinda-
Yes, please.
It is on the website.
And the odor
Okay.
complaint form is on the website. I did get a call from someone, and that's exactly what I called and left the message. There is an odor complaint form to be filled out, and that's the procedure we need to follow. So please, guys, fill it out, and then.
It is fillable on the computer, I believe, that one.
Is it? Okay, and then just send it to Nancy so that we have a record of this. Even if you're technically not complaining, we need to know when it was observed and how often. And then we'll have.
We should send somebody out to drive past there a few times a
No.
day. Is it smell today? Is it smell today? Is it smell today?
I unfortunately have had a lot of equipment break in the last week on my farm, and I've been up and down that road many times, and I have only smelled a small, tiny odor once. It was not
Did you lose any smell when you were sick?
I didn't lose my smell. My smell is better than it's been in a long time.
Wow, there you go. I don't know, but tonight, yeah, I don't know if it's from all the rain last night or
Yeah,
what.
it smells
Something.
very planty, like, you know, with the wet.
I
So-
didn't
wet.
notice at the rec field earlier. I didn't notice it
See, so it's,
Yeah. Oh my
Yeah, but
gosh.
it's down further though.
Yeah.
It's down.
So,
it's
Like
down.
last
Again,
year sometimes.
if
though, you could
anyone
smell
out
it.
there notices it, they can say, there's an opportunity to fill in how strong you felt it was, and the time, and so forth. If it didn't really bother you, but you were just reporting that you did notice some kind of odor, and you just wanted to have it accounted for, that's okay. You can do that too. It's not necessarily, like you said, not necessarily a complaint, but this is our format for tracking it. And so we do need documentation in order to track it, so that we can then have a discussion just to see how things were going with them as their businesses are being operated.
Yeah, I was just
And-
surprised we haven't heard anything from any of the neighbors yet.
Yeah,
So,
but I can, you know, the potency of that tonight, I can understand why there
And
was
so
some
then-
complaints last year.
so if you make clear what the potency was to you, and then we just will follow up with a discussion with them. But, prior to any formal notification, we'll reach out to them, cause that was the agreement, is that we would, if we get any formal reports / complaints, that we would have a good discussion with them, and they could have the opportunity, to report maybe what happened at that time. So, okay. Turnovers, and yes, we have the MPHN invoice.
So I didn't put that on a warrant because I didn't know exactly what we
Yeah.
were doing, so I'll put it on for next time.
are saying that they offer a lot of things, but as we have previously discussed, we were just gonna continue with the membership. It's based on population such and such is, a total of 600 per year, and that rate has not gone up for a number of years. So that's what I would suggest, and that the other inspectional services and such, that we not opt into for this year. You guys can look at that. That would be my recommendation. And as a member, then flu clinics can be done for our town. Cause what they have done is applied for, federal monies that are dispersed to the state of Massachusetts, which then can disperse funds based on a grant application. And that's what they've done in order to be able to provide these flu clinics in this area to the member towns at no cost to the town. So our $600 fee would definitely be worth it for that.
What are kiosk services?
I think that's probably for, disposal of needles.
Right, we have that through the police department already, so we're all set.
Not needles, but medications.
Medications, yeah. If we do need others things, we'll find out. So far, I haven't been asked by anyone for anything else. Okay, and you pass it to Lori to look at. So I make a motion that we pay the Hubbardston town fee of total of $600, which is listed in the list of current town members, for we are now in the 24 budget year. Do I hear a second?
I'll second.
All in favor?
Aye.
Aye.
Aye. Okay, it passes unanimously, so you can just, if you wanna put it
I
on,
think the warrant
when does that go in?
before our next meeting.
Yeah, I'll come in, and is it all right if I sign off on the warrant to have this paid in a timely manner
Yes.
before our next meeting?
Yes.
It's okay with
I think
everyone,
it's- It might make you just,
whenever it is,
Okay.
get a hold of me, and I'll sign it.
all right.
Yeah, I don't want them to say to me, no clinic, you didn't pay.
I know.
So,
Come
yeah,
on.
whenever that next cycle is,
Yep.
let me know, and I'll
Okay.
sign off on it,
Okay.
cause we approve, correct?
Yes.
We approve, all right. Next meeting, shall be Tuesday, September 26th.
I will not be here,
Okay, all right,
and did you
I
figure,
will.
you will?
Yeah.
Oh, okay, all right, so I won't.
okay. And we can always do it via Zoom if need be.
Oh, should be fun.
Okay, great. And I should be here. I have my wondering days of, things that have gone on. So I make a motion to adjourn at 7:59 PM. All in favor?
Aye.
Aye.
All right, meeting adjourned